how do you define perinatal mental health, and how does that differ from general mental health and wellness?
It's a really good question. And I love that we're using the term perinatal mental health because I think probably the term that more people are familiar with is postpartum depression, which is a much kind of smaller kind of zeroed in condition, which is real and still something a lot of people experience, but it doesn't really encompass the whole experience. So perinatal mental health, I would define as sort of your state of mental health during pregnancy or after the arrival of a child. And it is not specific to women, and it's not even specific to pregnancy. So you could experience perinatal health disorder or perinatal health challenge if you're a father, if you're a non-birthing parent, if you had a child via surrogacy, or really any way that a child comes into your family. You do not have to give birth to experience perinatal mental health challenges. That's part of it. And you can experience it during pregnancy as well, even though not everybody does. I think we think of it as something that only happens after the baby or the child comes, but it can in some cases start during pregnancy. And it's not just depression. There's depression, which is a big part of it. There's anxiety, there's OCD, there's psychosis, there's a whole kind of spectrum of different diagnoses that are included in that umbrella.